Have you ever left your doctor's office feeling like they were dismissive of your sleep issues? Unfortunately, many doctors wrongly assume that our sleep naturally has to get worse as we age. Nothing could be further from the truth. Just because you're aging does not mean you have to get bad sleep. So in this video, I'm going to walk through why traditional medicine often fails to address your issues and instead how to use my integrative step-by-step approach to getting those sleep problems fixed for good. Hey everyone, I'm Dr. Michael Bruce, the sleep doctor. The fact of the matter is, traditional medicine was not designed to help with sleep. This is why when you go to your doctor with a sleep problem, they often end up just prescribing a pill or ordering an MRI or just waving your problem off entirely. In the case of seniors, when they wave you off, it can be very, demoralizing, especially if you're told that you should just expect your sleep to get worse and worse as you get older. I think this is complete nonsense, and quite frankly, it's not true. Sleep does get harder as you age, but that does not mean that you can't do anything about it. I know plenty of seniors, including myself, that can still get great quality sleep up until their 70s, 80s, and beyond. What I have developed is what I call an integrative process for seniors to identify and solve their sleep problems. This step-by-step process will empower you to understand what's going on with your sleep and work towards solving these problems for good. But before we jump into that, I want to talk a little more about traditional medicine. Now, remember, traditional medicine is not inherently incapable of treating sleep issues. Of course not. There's an important role your doctor can play in fixing some of these problems for you. However, it is important to understand why traditional medicine is kind of ill-equipped to help with sleep. This information is important to know for two specific reasons. First, by understanding what your doctor cannot do, that will help you understand what role you need to play in solving your own sleep problems. Second, when you do approach your doctor, you'll have a better understanding of where they can help and how to get them to help you in a way that gets you the results you need. Now, why is it that your doctor often fails to help you with your sleep problems? I think there are probably three main reasons. Number one is a lack of physician training around sleep. You got to remember, sleep was not taken very seriously in the medical community until fairly recently. Outside of some specialties like people who are pulmonologists or neurologists, believe it or not, most medical students only receive about 2.5 hours of training on sleep and sleep disorders. 2.5 hours of training over the course of 4 years in medical school. The data shows 69% of physicians never discuss sleep at all with their patients. Another recent study found that physicians often see sleep problems as symptoms of other issues like depression, stress, or in some cases aging, rather than as a primary disorder. This leads to underdiagnosis and undertreatment of sleep-specific problems and is why certain sleep disorders like insomnia, sleep apnea, or restless leg syndrome are thought to be underdiagnosed or mismanaged. Number two, sleep is multifactorial, meaning sleep problems can arise from a mix of physical, psychological, environmental, and even behavioral issues. Traditional medicine tends to focus on just the biology or physiological aspects, which might miss things like stress and anxiety, poor sleep hygiene, lifestyle and habits, which play a huge role, or even environmental factors. These issues are also not well addressed in a 15-minute appointment. Chronic sleep issues often require in-depth assessments, long-term follow-ups, and a very personalized plan. But traditional medicine really isn't structured for that. It's structured for quick visits and acute care, which really doesn't fit the complexity of sleep disorders. In addition, older adults often have multiple health issues that require more time to assess. This can lead to less personalized, less effective care. And because traditional medicine focuses on biological or physiological factors, medical doctors are more likely to address your issues by prescribing a medicine like sleeping pills as a first line of treatment. And the third reason, something called medical bias. Medical bias against seniors, often called ageism, is a recognized issue in healthcare. Many clinicians unconsciously assume that cognitive decline is normal in old age, that seniors are less interested in improving the quality of their life, and that fatigue, pain, or, you guessed it, sleep issues are just part of getting older. So instead of investigating these issues, your sleep issues may be dismissed as just aging. And this is a misconception that is often held by both doctors and patients. You might assume that because you're older, that because sleep is not as easy as it once was, that there's nothing you can do about it. But there is. So next, I'm going to walk you through my 5-step integrative process for fixing your sleep. This is not going to be just a bunch of sleep tips you had heard over and over again. This is a high-level strategic approach to troubleshooting and fixing your sleep that my older patients have used time and time again to great success. But real quick, if you're interested in getting better sleep, please subscribe to my channel. I've got a bunch of great content coming out soon that you're not going to want to miss. And while you're at it, go check out my website, sleepdoctor.com. It has tons of sleep content, articles, even a shop. I'll leave a link down below. Step 1 in my 5-step integrative process is that you need to rethink your sleep, or what I call get a sleep mindset. You can get better sleep, but it's probably not going to happen overnight. Remember, sleep is multifactorial and very personal, meaning there are very specific things that help your sleep and hurt your sleep. Think of sleep as a daily practice you dedicate to working towards improving. However, I want to make sure you're being kind to yourself. The last thing I want anyone to do is feel guilty or stressed out about their sleep problems. That will only make things worse. If you did not get a good night's sleep, that's fine. If you've not been sleeping for a while, that's okay too. We will figure it out. So fixing your sleep, especially if you're a senior, takes patience, takes time, and it takes dedication. It is a process, something you do, and we will make it work. Step number 2 is to start tracking your sleep. And no, I don't mean with some expensive sleep tracker or wearable. While digital sleep trackers can be nice tools, trackers only provide objective data and lack insight into subjective experiences, like how rested you feel. In addition, many of these devices can be inaccurate. Instead, what I want you to do is keep what I call a sleep diary. Keeping a sleep diary is one of the most powerful tools for improving your sleep. I cannot emphasize this enough. I have every single patient of mine keep a sleep diary. It's that important. A sleep diary is key in identifying sleep issues and personalizing your remedies over time. Another reason I like sleep diaries, honestly, maintaining a sleep diary is active. Taking the time to write your daily entries builds awareness as well as accountability for yourself and provides a time for reflection in the morning on what may be helping or potentially hurting your sleep. Because of that, my patients often uncover patterns and self-correct issues after just a few weeks. Plus, having a sleep diary is necessary in order for the following steps in the program to work. So make sure you're prioritizing using one. To help get you started, I've created a sleep diary template specifically for seniors that you can download and print out from a link in the description below. I suggest making entries shortly after waking every morning. The goal is to find a routine that's easy to maintain long-term. Also, I find it best to keep the journal right next to your bed and avoid using a computer or even a tablet for this. A notebook or a pad of paper is perfect. All right, there are 10 questions I want you to track. Here they are. What time you went to bed? Give a clock time if you can. Then I want you to think back and guess as to what time you fell asleep. I don't want you watching the clock until you fall asleep. That's the opposite of what I want you to do. Just a quick guess, I think that'll be accurate enough. Then what time you woke up, and then what time you got out of bed. Believe it or not, these might not be the same, especially if you hit the dreaded snooze button a few times. There might be some space in there. Please let us know. Then how many times you woke up in the night. Also, if you woke up, make a guess for about how long you were awake for each one of those times. So for example, if you were awake 3 times and one time was for 5 minutes, one time was for 35 minutes, and one time might have been for 10 minutes. Again, these are guesses. Don't watch the clock. Just write those down. The next question is, how many naps did you take yesterday? Also, how long was each nap? And then finally, rate the quality of your sleep on a scale from 1 to 5, and then the quantity of your sleep on a scale from 1 to 4, based on how refreshed and rested you feel. Also, feel free to jot down anything different you might have done the day before. So maybe you were working in the garden, maybe your grandchildren or your kids came over for an evening dinner, something like that, a large meal, extra cup of coffee. Make sure to take note of anything that you think could affect your sleep. You'll work through these questions in just a matter of minutes each morning, and you'll get into a groove pretty fast, I promise, especially if you make your diary just a part of your daily morning routine. Recording small details daily leads to big picture awareness. As you continue to track your sleep, you're going to easily be able to see how it's improving over time, and that's going to be pretty awesome. Next, I want you to focus on improving what's called your sleep hygiene and your sleep environment. Sleep hygiene refers to the practices and habits that are conducive to sleeping well. These are things that you can do every day on your own, and they're kind of the bedrock of good sleep. I always say proper sleep hygiene will not necessarily solve your sleep problems, but you will not solve your sleep problems without proper sleep hygiene. Sleep environment, on the other hand, refers to the physical surroundings and condition in which you sleep, namely your bedroom. The reason this step is important is that we want to make sure that your sleep issues are not being caused by something behavioral, like drinking too much caffeine, or environmental, like sleeping in a room that's too hot. Now, sleep hygiene can refer to hundreds of habits and behaviors, but to keep things simple, I want you to focus on the 6 biggest behaviors that can improve your sleep. Follow a consistent sleep schedule, hopefully based on your chronotype. Eliminate all caffeine starting at 2 p.m. Limit your naps to 30 minutes and do not nap after 3 p.m. Stop alcohol 3 hours before bed. Get exercise every day, but not within 4 hours of bed. And get 15 minutes of sunshine every single morning. If you do those things, I promise you your sleep will improve and you'll see it reflected on your sleep diary. Next, for your sleep environment. Similarly, I want you to focus on 3 big things. The first is to make sure your bedroom is the right temperature. For sleep, we like it to be very cool if at all possible. Don't go past 65 degrees and keep it within 72 degrees. So that range seems to work quite well. 68 is probably just about perfect. Next, I want you to make sure you are minimizing light disruption through either an eye mask or blackout curtains. Finally, minimize sound disruptions by using either a white noise machine or earplugs. As you implement new positive sleep habits and changes to your sleep environment, you can see how they are improving your sleep while tracking it in the sleep diary. But I want you to think of these things as the bare minimum you should be doing if you are serious about fixing your sleep. Before we go on to the next step, give yourself about 3 weeks to track and monitor how these changes are improving your sleep. Your body usually needs a full circadian cycle, about 21 days or roughly 3 weeks, to fully adjust to these changes and to start seeing their impact. If you're not sleeping better after 3 weeks, it is time for our next step, which is, you guessed it, talking to your doctor. I know I said earlier that traditional medicine is not equipped to handle most sleep problems, but your doctor can be extremely helpful in addressing your sleep issues if you know the right way to talk to them about these problems. You just have to think of it more like a collaboration. To do that, you first need to plan ahead, which is why we've been keeping a sleep diary and practicing good sleep hygiene. Because a lot of times someone will go to visit their doctor with a sleep problem and the doctor will say, go practice good sleep hygiene and track them in a sleep diary and then come back in 6 months. If you've been doing those 2 things beforehand, you are going to be that much more prepared when you speak with your doctor. You'll have objective data to show them, and you'll have already been following the main sleep hygiene guidelines. When you visit your doctor, plan on asking them about 3 things. Number 1, have your doctor review your medications and make sure nothing is potentially causing a sleep problem. You would be surprised how many medications can interfere with sleep or make you feel groggy the next day. For example, some antidepressants have got very stimulating properties. Corticosteroids used to reduce inflammation could cause insomnia when taken at high dosages. Even beta blockers used for blood pressure and heart conditions can reduce melatonin production. And believe it or not, thyroid medications can cause anxiety disrupting sleep, and some migraine medications contain caffeine. Your doctor will be able to help you identify what these medications are and either provide you with non-sleep disrupting alternatives or find a more suitable time of day to take them, like maybe in the morning. Number 2, ask your doctor to run blood work to make sure that you don't have a vitamin or mineral deficiency that could be affecting your sleep. This can be a really common problem, especially with seniors. As we get older, our bodies get less efficient at processing certain nutrients, leading to deficiencies. I would specifically ask them to check your iron levels, your magnesium levels, your vitamin D levels, and your zinc levels. Any one of these could be a culprit for your sleep issues. The good news is, if you're found to be deficient in one of these, simple over-the-counter supplementation might be all your body needs. Number 3, you want to see if your doctor can help you rule out any serious medical conditions or a sleep disorder. Oftentimes, sleep disorders like sleep apnea have a very specific treatment protocol that can be very effective. However, they are difficult to implement on your own and work best under a doctor's care. Likewise, if you do have a medical condition affecting your sleep, such as an enlarged prostate or gastroesophageal reflux disease, your doctor will be the best chance at getting these issues fixed. Before we move on to our last steps, let me summarize what we've done so far. Remember when I said that sleep problems have a combination of physical, psychological, environmental, and behavioral causes? Well, essentially what we've been doing in the 4 previous steps is systematically ruling out or eliminating the causes from some of these categories. If you've reached this point and your sleep diary is indicating that your sleep is not improving, there's a good chance the cause of your sleep issues aren't behavioral or environmental or physical, but are instead psychological. Now, fortunately, there's very effective research-backed treatment option for dealing with the underlying psychological roots of sleeplessness, and it's called cognitive behavioral therapy for insomnia. CBTI is based on the idea that insomnia is sustained by unhelpful thoughts and beliefs related to sleep. For instance, when you're lying awake at night, you might think, if I don't fall asleep right now, tomorrow is ruined. Or I need 8 full hours or I won't be able to function. Or something must be wrong with me because I can't sleep. These thoughts increase stress as well as frustration, which raises your arousal level and makes it even harder to sleep. CBTI helps to interrupt this pattern by teaching you how to reshape your thinking surrounding sleep. Let me give you a few examples. I didn't sleep well, so I won't be able to do anything tomorrow. CBTI might help reframe this as, I've gotten through days with little sleep before, I might be tired, but I can still manage. Or if you think, I need to try harder to fall asleep, you'd learn to reframe that as, sleep is a natural process. The harder I try, the more I interfere. My role is to relax and allow sleep to happen. These rigid beliefs about sleep often lead to more stress and self-criticism. Shifting them helps you reconnect with your body's natural ability to rest and takes the pressure off. With CBTI, you're going to learn to identify these thoughts, evaluate them realistically, and replace them with calmer, more supportive ones, which leads to better sleep over time. Plus, CBTI has been shown to be very effective at treating sleep issues. 70 to 80% of people with chronic insomnia see significant improvement in sleep quality after CBTI, including faster sleep onset, so falling asleep more quickly, fewer awakenings, and better daytime functioning. To learn more about CBTI and some other advanced treatment options for your sleep, check out this deep dive video I made right here. This is Dr. Michael Bruce, the Sleep Doctor, wishing you sweet dreams.